And then I think also one of the things I'd love to hear your take on this, because there is a belief system, right? There is a belief systems in people's minds still that, healthcare, medicine, FDA, government, they can't be all like, against it. And if they're not talking about this, then it can't be really something that is so, significant to our health. So, part of it is also, Luciana, I think education is great, but how do we then change the belief system that takes time to unravel and basically everything you've been taught deprogram?
I think it goes back to the Flexner report
Yeah,
because it all stems from there because it has to start in school where the doctors are being trained.
that's right.
Because people are listening to the doctors up until now. I guess we're in an era of communication now where this is changing,
Yeah,
but it all stems as a residual thing from that, where you listen to the doctor. If he's not talking about it, then it's quackery,
yeah,
and this has been perpetrated and it's floating out there. I ask, like I told you, I go to a dentist. I turn around, hey, you guys use ozone here, right? Because ozone in dentistry is such
huge.
a no-brainer.
Yeah,
It's
yeah.
such a
It's
no-brainer because it's
probably the
topical,
easiest way to start with
easiest
something
way.
is
Try
dental.
it for yourself, like I did with my friend. Put it on your
Yep.
infected tooth or your inflamed gum, and call me the next day. Literally, I'll be waiting. It's
Yeah.
illegal. So in dentistry, it's such a no-brainer. And the other nice aspect that I want to explore in the film is how it's being used in veterinarian use.
Mm,
Because, and this is the important point, animals don't have placebo effect.
this is right.
So explain this to me now. How, and you look at the testimonials, how anything, let's not even mention anything on the skin, that animals get a lot of problems, in their skin
Sure.
and the fur. Gone. I did that with my mom's cat one day. She called me the same, it's a pattern. The
Yes.
next day she calls me. She says, what do you, this thing is amazing. I could see the ear, she had a bite in the ear or something.
Mhm.
The cat, I could see it heal, like it's done, it's healed. Yeah,
Yeah.
I know. Like I know. I roll my eyes. I'm like, oh, so this is like I know. I know what I'm gonna hear the next day.
Yeah.
So
I've I-
that's
I've heard people say that both animals and children are the best patients because they don't have those preconceived notions of whether something is going to work or not. They just accept it as is, right? Because they don't know what's happening in a sense. And that's why so-called alternative therapies work so well. You have horses that heal so quickly with PEMF, with ozone, with all these things that are alternative, but the veterinarians are using it, seeing great, great results. And that also goes back to placebo, effect is really just your belief system in something.
right. Which is definitely a thing.
Oh,
If,
huge.
if it's a thing that you can use in your favor,
Yes.
but just to prove to, I guess, deniers, the animal aspect is a great one to show,
Yeah.
because I've seen things in the photos I've seen in the conferences and such, where here's the distinction. Like it's not like they put ozone and it healed, and how do you know it worked or how fast? No, no, no. These were animals that were put on traditional
Right.
medical treatments and nothing wasn't working. It wasn't working. Weeks or months on antibiotics, nothing's going on. They do ozone a few times and it's done, resolved.
Yeah.
So that's the main point. I saw a horse that had its entire back like open. It felt like a butterfly steak. I had never seen anything more shocking in my life. I'm like, how is
Hmm.
this horse even standing? They bag the horse with the bag and ozone bagging. So you cover the
Yeah.
skin with a bag and you send ozonated gas there, and slow. The only thing they did slowly that wound. I'm back to almost no stitches, nothing. I mean, you couldn't even stitch it. It was a foot
Right.
wide, like
Wow.
so this is mind blowing,
It
and
really is.
deserves to be documented. There's another aspect that's it's kind of like a hush hush thing, which this is very fabulous for athletic performance and
Yeah.
athletic enhancement. And there's it's gone. I don't know really if it's considered doping or anti, is it for sport, competitive sports? don't think it is, especially if you're not doing anything with the blood. So
Yeah.
it's being used all over the place. And for any traumatic injury, that's the thing. When they discover prolozone, which is the injection directly onto a joint of the ozone gas, which works locally instead of systemically, like the blood treatment. You see it in the trailer.
Yeah.
That trailer was filmed. I was at that clinic for 1 day and a half.
Hmm.
And I was exposed to the patients that were there that day. It's not even a premeditated thing that I looked for the world for the most impressive treatments, sort of patients' testimonials.
Yeah.
This was just what I found that day. Maybe when I went there, if there wasn't anybody there, then the trailer wouldn't have those testimonials. It's just they were there.
Right.
And all of them are incredible. Like
Yeah.
some guy that doesn't know why, he doesn't want to know. He's like, dude, they gave me they gave me this injection in my back. I threw it out in the gym. I walked out of here done. Then the old lady is really funny that she's been using it for her vision and does nothing else,
Hmm.
and she's 91.
Hmm.
And the lady with the arthritis in the hands, and this is something you can see, you can visually see it. And she told me she couldn't even put the zipper up in her pants because it hurt so much, that just that movement. And that how ozone first treatment, she's like, what is this? I feel it already. Like it's
Yeah.
bringing down the inflammation. And the lab work shows that the proof is in the pudding. Like the lab work shows with numbers. So it's what else? That's our need. What else do we
Right.
need to prove it, right?
And if nothing else, I would hope that people, by bringing their awareness to it, would at least say, why wouldn't I try this first before I go to something that has side effects or that may require surgical intervention that is quite invasive with a lot of possible complications? I've always thought that, it's one thing to be even skeptical, but why wouldn't you try something and work your way up to the most kind of side effect or most kind of invasive type of approach and not start there and then work backwards and then finally end up, with, oh, all right, I'll try ozone after doing all the drugs that, have had so many side effects, surgery that didn't take, and now I have surgical scars and all these other things. Why won't we start there? And I'm hoping this is what we're able to find out, is that people's awareness will say, well, why don't I try it before I go to the drugs for life?
Right. There's a place for everything. I mean, modern medicine, it's science fiction. It's incredible what it can do.
Sure.
It's more designed to save you from drastic situations. But this is actual health and health prevention, which is a different story.
Yeah.
Look, it takes two to tango. I always say this because there's a tendency to blame the system and blame the doctors, and yeah, that's very tempting. And it feels like you're in with a cool crowd when you say that. But it takes two to tango. Also, people, I think we're entering the era where it's in your best interest to become a biohacker, so to
Yes.
speak, and sort of take a little bit of more control and decide. And from the menu of options that are out there, I don't see a world where the paternalistic, doctor
Hmm.
patient relationship is definitely been broken. And maybe the old timers are still, I understand how this is a weird concept, but with the amount of information that exists today, and most people who are healing traumatic things and situations, they had to become biohackers
Yeah.
and look for themselves and try things and put a lot of effort and become the CEO of your health. This is, I
Most of the
think,
time it's out of that necessity, right? If you're sick and you're running out of options, it's necessary to look outside that and be your own best advocate.
yeah. So it takes two to tango. You can blame them all you want, but if you're not, if you just want the pill and the quick fix, then it's on you too. So
Right.
that's why I think ozone is a beautiful biohacking modality, and to use that word, but like a healing modality that you can access yourself at home if you want to, if you're so
Right.
inclined and you're adventurous enough with the right, coaching and knowledge how to do it. Otherwise, go to a clinic and you get it done there. And like you said, then you can escalate from there. And the other thing is, it's also a very good adjunct to any other therapy. It makes them better. It makes everything better.
Hugely.
Take
Yeah.
antibiotics, you do ozone, it's like, wow. For any, that's what I'm learning. And so, and it's a
Hmm.
great palliative for people who are in terminal situations. It just makes things better. So,
Yeah.
like the doctor says in the movie, in the trailer, I'm not gonna sit here and say ozone cures anything.
Hmm.
Let's start there. It's not the ozone, it's your body being awakened to do the right thing. And yeah, ozone directly has an oxidative thing onto pathogens, but the rest is your body doing the right thing and being instructed by the ozone signal to do the right things.
It's simply a natural catalyst to your self-healing mechanisms. And that's what else could you want in healing is just something to awaken what you already have inside of you to make you the healthiest version of you. So,
It
no,
is.
I always said it's something everyone should look at, and I really do hope this documentary allows people to at least become aware of it and start to see how powerful this could be.